probably some sterile 2x2s, sterile gloves if it's not in my suture kit, which I'm assuming it would be.
It'll be in the suture kit. Those 2x2s typically are.
Okay. Going to go to my patient's room, knock on the door, introduce myself to the patient, verify their name, date of birth, and explain the procedure to the patient. I'm going to elevate the bed. I'm going to position them in a supine position to prevent air embolism. I'm going to wash my hands. I'm going to don gloves. I'm going to turn off the electronic infusion device and clamp the tubing. Clamp both tubings. Remove the dressing and securement device. So since I just put this on, and take it off. Yeah. Okay.
Or pretend you took it off.
So the dressing is removed on the bottom one now?
Okay, so I'll take this one off. So I washed my hands, putting on gloves. Okay. I said that already, didn't I? Mm-hmm. Alright, so I'm going to remove the dressing and the securement device. Okay. Inspect the dressing in the site for signs of drainage or inflammation. Clean it with an antimicrobial swab. Should be like a chlorhexidine maybe?
Mm-hmm.
Okay. So we want to do the same thing, center to out. Let that dry. Discard the dressing in a biohazard container. Remove gloves and wash my hands. So I'm going to remove my gloves, wash my hands. Place a 4x4 gauze, skin antiseptics, suture removal kit, and dressing materials in close proximity to the patient. And then open them using sterile technique, is I'm guessing what it's supposed to say. Okay, I'm going to put on my sterile gloves. And out of my suture removal kit, I got my handy dandy scissors. So I'm going to clip the sutures in here.
Have you guys taken sutures out?
No. Well, I mean, I've taken staples out.
Okay. Then I'm going to use a forceps and gently remove this while I have the patient perform a Valsalva's maneuver to prevent air emboli. I'm just going to use one smooth motion.
It isn't going to come out, so pull as far as you can.
So I'm going to use
we'll just say it's
smooth
out.
motion.
We're
it's
out.
Okay.
So, what are the forceps?
Where did the forceps go?
On the tube. I don't know why, because
Like a plier?
yeah, like a needle nose.
Needle nose, but it's not. It's kind
Yeah,
of.
why?
A forceps isn't. It's actually like a tweezer. In the suture removal kit, you're going to have a little curved scissor, but a forceps is, or that it's like a tweezer. Is what they're referencing. Okay.
All right. So I'm going to apply a sterile gauze pad over the insertion site to seal it. Nope. And apply pressure. Okay. Then I'm going to apply.
You want to stop the bleeding, and you're going to apply pressure for.
I'm going to apply an antibiotic ointment to the insertion site to seal it.
After it's done bleeding.
After it's done bleeding.
You don't want to let it bleed. You want to hold it long enough so it's.
Yeah.
Is it in the package?
It is all sterile.
This
Priscilla.
is another Tagaderm.
It has to be.
Right.
And you would have the patient mask. Same step.
Then it doesn't say anything about putting a mask on him, but okay, so then I'm going to put my Tagaderm on.
So you have a 2x2 and ointment after that?
Nope, just after I take it out, I have pressure on it to stop bleeding. After it stops bleeding, take this off, do some ointment to seal it so that it doesn't suck some air in there.
And the dressing.
Why wouldn't
And
you
then
want a mask on when you're taking it out until it's covered? Wouldn't you?
Sure, you wouldn't be wrong to do it.
Always err on the side of caution. That's why I said when we do this, if we just would have had her skip some of those steps, because once she changed the dressing, it's like, okay, Jonna, flush it and discontinue it. Because you guys, I think we have you thinking so many, I don't know. Maybe I make it harder. I don't know.
So I have my Tagaderm on. I'm going to remove the outside of the dressing and label it with the date, the time, my initials, and inspect the catheter to make sure there aren't any pieces missing. If the doctor wants a culture of it, I would have also needed a sterile specimen container and a sterile scissors. Clip off the last inch, drop it in the sterile specimen container, properly dispose of the IV tubing, assess the dressing site. By 72 hours it should be sealed, wash my hands, document